Guys, my today's topic is granuloma, and we know that granuloma is composed of epithelioid cells with surrounding mononuclear cells and the multinucleated giant cell. So what I think about the granuloma, that it is a film and in which the hero is the macrophage. Why I said that it is a whole story based on the macrophage? Why I said that? Because if I said that activated macrophage, so it means I am going to say about the epithelioid cell, because it looks like the epithelial cells, so we call epithelioid cells. And I say the multinucleated giant cell, it is fused macrophages. When macrophage become fused, it becomes a multinucleated giant cell. And of course the mononuclear cells is the not the macrophage, but it is Th1 lymphocyte. So it is the whole story of the macrophage. Now if I go further, so what a doctor thinks about the granuloma, it is well circumscribed, firm, nodular, white grey. So doctor described granuloma like this, and we know that it is infectious granuloma, and there are granuloma which is non-infectious. So first, in which disease the infectious granuloma is found? And I know it's a bit creaming, but you have to do this and memorize the most important. The famous one is the Mycobacterium tuberculosis and leprosy, listeria grammatis inseptica, fungi mostly histoplasmosis, coccidiosis, and the parasite schistosomiasis, and the Bartonella, tertiary syphilis. I know it is hard to memorize, but we have to memorize this. And if I talk about the non-infectious granuloma, so there are many. First of all, Crohn's disease, sarcoid, PBC, primary biliary cirrhosis, Wagner, and the Churg-Strauss syndrome, and the giant cell temporal arteritis, and the berylliosis, and the Chiasso arteritis, talcosis, and many more. Now let's look the picture of the granuloma so that we can appreciate the granuloma. Now what is granuloma? So let's look a picture. Here is the central caseation if it is infectious granuloma, and I said it is covered by the activated macrophages, and the macrophage fuse to form the multinucleated giant cell, and of course the surrounding lymphocyte, which is of mononuclear cells, which is T lymphocyte, and it is walling of the by the layer of fibroblasts So what I said, that central caseation surrounded by the activated macrophage, and some macrophage become fused to form the multi-integrated giant cell, and there is a Th1 lymphocyte, which is our mononuclear cells, and this is a picture of the granuloma. So what the Th1 lymphocyte is doing, it is secreting interferon gamma, and interferon gamma causes the macrophage to become activated, and macrophage in response to release the tumor necrosis factor alpha. Okay, now tell me, what is this? It is fibroblast layer, it is multinucleated giant cell, and it is Th1 lymphocyte. There is a central caseation. Okay, what I said, that the Th1 lymphocyte secretes the interferon gamma, which causes the macrophage to be activated, and we know that activated macrophage secrete the tumor necrosis factor alpha, which is responsible for the maintenance of the granuloma at wall of the infection, so that the infection cannot disseminate or spread. Suppose in the TB we found the same thing, then macrophage is walling off the TB infection so that TB would not disseminate. If I go beyond this further, we know that there are tumor necrosis factor inhibitor monoclonal antibodies which we use to treat the ankylosing spondylitis, psoriasis, and rheumatoid arthritis, and many more autoimmune diseases. So suppose a patient come and I have to prescribe this medication. So first of all, we have to do the test of PPD in such type of patient before prescribing that tumor necrosis factor alpha inhibitor drugs. What are the drugs? Name them: adalimumab, certolizumab, infliximab, and etanercept. Wait a minute, etanercept is not a monoclonal antibody, but it is a decoy receptor. So what I ask the question is that when we are prescribing this drug, we have to check for the TB. We do the PPT test, which is tuberculin test. If it comes the positive, so we avoid this drug, because if we give the tumor necrosis factor alpha inhibitor, the granuloma will no longer to be maintained and it bursts out and the TB will disseminate. So dissemination of the TB will be there if I prescribe the tumor necrosis factor alpha inhibitor. Okay, this is the one story, and the other story is about the hypercalcemia which I found in the granulomatous patient. Okay, now why the hypercalcemia is found? Because we know the granuloma containing one enzyme which is alpha 1 hydroxylase. When it activated, it causes the conversion of the 25 hydroxy vitamin D to convert it to its active form. Now what happened? The vitamin D will be elevated and it causes the calcium and phosphate reabsorption from the GI, and in this way the patient will present with the hypercalcemia. Okay guys, now this is all about the granuloma. I hope it helped and you will better appreciate the granuloma when you see the pictures of the granuloma. I hope it helped. Don't forget to like and subscribe. See you in the next lecture.